Before school even starts, respiratory viruses are spreading among kids. Just last month, more than 1,000 patients tested positive for infections that are not COVID-19. In Health Watch, WCCO's Reg Chapman explains what kids are catching and how parents can help prevent it.
Hospital staffs across the metro are stretched, treating an increasing number of children with RSV.
Since 2017, we have been seeing a newer strain of RSV that's been circulating in the upper Midwest that is perhaps a little bit more virulent or a little bit more nasty.
RSV usually infects kids ages 0 to 5, but this latest strain is infecting older kids during summer months, and that is unusual for this predominantly winter virus.
A lot of adults and older kids that get it may just have a runny nose and think, oh, it's my allergies because my nose is really running, and they're really not sick otherwise, which is how it keeps spreading in the community.
Hennepin Healthcare's Dr. Stacine Moralchik says the symptoms are similar to those of the common cold.
But when you're a baby, say under a year of age, you have that really runny nose, you have a fever, and you have a cough with wheezing, often what we call bronchiolitis. And those kids can often have a lot of congestion in their chest, which blocks up their airways and causes them difficulty breathing, which means they may need to come into the hospital for respiratory support.
Especially if that child has asthma or a compromised immune system, they may need oxygen and, in extreme cases, a ventilator.
The American Academy of Pediatrics put out a policy statement that strongly recommended children that are able, age 2 and up, to wear masks because that's about the only thing you can do.
With the rise in COVID-19 cases in children as well, parents are urged to get their kids tested.
We have seen a lot more COVID in kids lately, and we've also seen a lot more RSV. But without the test, it's hard to tell one from the other because they're both cold viruses.
Reg Chapman, WCCO 4 News.
Other tips for parents: keep children at home if they are sick and frequently wash their hands.